For the cytomegalovirus, it is under the beta group viruses, asymptomatic among healthy individuals but may cause devastating systematic infection in neonates and immunocompromised patients. We have a manner of spread. It can be a transplacental transmission, which is another term would be congenital CMV or cardiomegalovirus. It occurs when the mother, it occurs in mother who doesn't have the protective antibodies and would resemble erythroblastosis fetalis and may manifest with microcephaly, calcification, growth retardation, hepatitis, jaundice, and anemia. And it can also be a neonatal transmission. It's actually a perinatal cardiomegalovirus, which is transmitted through the birth canal or through the breast milk. While for the respiratory droplets, it's a common mode of transmission wherein um, the virus is transmitted most commonly in daycare centers where children would want to put anything in their mouth and then touch anything with their hands. So that's how the disease or the virus was spread. Transmission by the venereal route or sexual dominant. The usual route, this is the usual route by people who are more than 15 years old. So this is through the sexual contact and it will present to them. It's actually a dominant type of virus. Pathogenic virus can be gotten from blood transfusion or organ transplantation. So CMV is the most common opportunistic viral pathogen in AIDS. So if you're asked a patient who has AIDS caught a viral pathogen and what is the most common opportunistic viral pathogen, will answer CMV. CMV will lead to pneumonitis and colitis. CMV can infect dendritic cells, maturation, and T cell stimulation. So it can both activate and evade natural killer cells. So characteristic histological feature would be enlargement or gigantism of infected cells in the presence of enlarged nucleus with intranuclear basophilic inclusion body surrounded by a clear halo. So this is what I am talking about. It's actually um, an owl's eye appearance. There will be inclusion bodies which may be either intranuclear or cytoplasmic. Here you can see the clear halo, this one, and the infected cell. This is the infected cell with intranuclear body, enlarged cell. This is a large cell with a large nuclei. So that is the owl's eye appearance in histological finding is actually a characteristic of what infection? CMV infection. So when you inspect the grossly, it's actually um, the cecum would present with necrosis and ulceration of the mucosa leading to diarrhea and usually in immunocompromised patients. So a classic cytomegalic inclusion disease is a very important concept wherein the virus is acquired from a mother with primary infection or no protective antibodies, what I said a while ago. And then it resembles erythroblastosis fetalis and would present with these disorders: mental disorder, anemia, and bleeding. Perinatal infection, it's actually through the breast milk, that's why I said a while ago. And cytomegalovirus mononucleosis, um, the most common clinical manifestation of CNV infection would be this one. Post beyond the neonatal period infections like the mononuclear the mononucleosis-like illness will present with fever, a typical lymphocytosis, lymphadenopathy, hepatomegaly with abnormal liver function test, which would suggest a mild hepatitis. So this is very important. Cytomegalovirus mononucleosis. That is the most common clinical manifestation. So what you need to remember in exams, the ones that are frequently asked are the most common or the exemptions. CMV in immunocompromised individuals. are susceptible to severe. So if you do not have a good immune system, you will present with a severe CMV infection. CMV, what I said, is the most common viral pathogen in AIDS. And recipients of solid organs can also be um, may contract CMV from a donor organ. So this is a picture of nuclear and cytoplasmic inclusion in the lungs, which is primarily infected organ causing pneumonitis. And then this is actually colitis or CMV in the cecum.